have side effects like, hair loss, nausea, vomiting, increased risk of infection, fatigue. There's a lot of them. What about brain damage?
Well, what we do know is that there are now neuroimaging studies that have been done showing that there are actual changes in certain volume of parts of the brain in patients who have gone through certain types of treatment with some chemotherapies, as well as changes in the connections, or what we call the white matter that connects those different parts of the brain associated with treatment. So there are some changes to the brain with certain types of chemotherapy. The good news is that some of those longitudinal studies have shown that many of those changes return back to normal sometime after chemotherapy or some types of radiation treatment.
Now, according to reports, cancer-related cognitive dysfunction, also known as chemo brain, has been reported in as many as 75% of people receiving cancer treatment. We have a graphic showing multiple factors that can contribute to cancer-related cognitive dysfunction. Here they are, doctor: chemotherapy.
Exactly. There are certain types of chemotherapy that may be a bit more toxic to certain brain cells. Radiation therapy, surgery, and other treatments. Keep in mind, all of these lead to increased inflammation. And at the end of the day, the belief is that it's the increased inflammation that leads to these changes in the chemical structure and in the neuroanatomical structure.